Welcome to Soft Bites Podcast. Your life, your dentistry. We talk about ways to have more fun and meaning in one of the coolest and most rewarding professions in medicine. Conversations on how to bring awareness, create a healthy workplace, and provide emotional insights to make dentistry a fulfilling activity while making space for one's wonder, creativity, and freedom. Here are your hosts, Manuela and George Andre.
Feeling insensitive, feeling guilt and feeling insensitive. And then for the stress for today is like, I don't know if this is an emotion, but it's the stress from the from this day exactly of what happened today. I would consider that as pressure, I don't know if it is an emotion, but just pressure. I mean, you just...
And there was surprise also. You were
There was surprise, yes.
That's an emotion too. There was some confusion,
Yes.
I'm sure, at least on the
there
first
was also,
seconds.
You know, when you start to numb and you see, okay, let me see what's going on with this implant. Everything is okay. Just remove. No, you remove the implant.
There was, I'm sure, a few moments of confusion, of not believing what's going on.
This is not good news. We lost one of the implants. And then I just start to look at the others. I say, wow. And I just remove one. I didn't say anything. I removed the third. And I placed the three of them. And I just kept working without saying anything to the guy for the next couple of minutes, just trying to get myself together to say, what's the rational speech that I'm going to tell this guy that is simple, that is effective, that is honest, and that is the best way. And make it simple for the guy.
I wrote here while you were talking. I wrote this, and I think in the end,
can I be fixed? Am I fixable? Am I fixable or no, doctor?
It's not about fixing. But look, I wrote surprise. I wrote confusion. I wrote sad and frustration. I think there was four emotions that you might have.
Yes, sadness. Sadness and frustration. Absolutely. Yeah. Because you have to not renew the contract of someone that is fulfilling her dreams, and she is not a bad assistant. She was hardworking. She was humble.
Yeah, I totally understand.
She was humble. She was hardworking, but it was difficult for me to take that decision.
To do, like I told you, it's very interesting. And if you have the time, I will put it on the episode notes. Also, the show of Brené Brown on HBO. It's called The Atlas of the Heart, and it's about emotion. It's very interesting because she says that we are not used to notice our emotions, and usually it's just like we have there's a whole range of emotions, but we just access like three. We're happy or sad or anxious, maybe. But then if we are asked to go further than that, we really have difficulties on naming our emotions because we are not used to notice our emotions. And it was interesting because you told the stories and this, but
it's
interesting because we are
difficult to identify them.
But it's not only for you, Andrea. It's for us nowadays as a society. That's what we were talking before. It's like emotions have no place in our life today. Emotions have no place, and they are important. They contain information. They are on the base of our decisions. They emotional awareness, again, it enables us to even to shift perspective, like we just said. So, but we are not
used to.
I mean, even used to, educated. It's like it's a weakness.
Yes, yes, we consider
it's a weakness.
We look at it as a weakness.
That's it, and it's not. It's actually a power. Emotional awareness. It's actually a power, and that leads me to my second question, which is all these emotions. So surprise, confusion, sadness, frustration, guilt, they express themselves in your body. How
they
were you aware of that?
themselves in my...
All of that.
Yes, tension in my face and my shoulders. I think it's face and shoulders more than anything.
Mhm, 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 mhm. So one of the ways that we train that in the mindfulness training is through the first. I said this already. First, we have to always start with the body awareness. So that's with the meditation called body scan. So because that's where we start to bring awareness on our body, and then we can start to slowly bring awareness to how we are feeling. For example, if you do, I know you have a meditation practice.
Yes.
If you join to your meditation practice, you do what you usually do during your meditation practice, right?
Yeah.
But if you start bringing some minutes during your meditation practice to, okay, how am I today? How what is going on here? How am I feeling today? And if you start naming, real labeling your emotions, okay,
Mm-hmm.
there's anxiety, there's fear, there's happiness, there's joy, there's sadness, there is the I don't know, boredom,
Mm-hmm.
contempt,
Yes.
disgust. There's a lot of emotions. But if you start really, okay, how am I today? And if you start noticing how that emotion expresses on your body, okay, there is sadness here. I have this constriction on my chest or in my belly. That's how you train emotional awareness. So that's the training. Of course, it's not as simple as this,
Yes.
but basically, this is a way of training emotional awareness. That is then when you are in the situation during the day, and if you are able to, you can also try to just notice what's going on, because if we notice what's going on, if you give it a name, then our rational part solves it and say, okay, I'm stressed. There is surprise here, and I'm feeling tense. I have this. My shoulders are heavy. Let me, okay, open up,
Yes.
ground yourself, and continue working from that place of groundness and relaxation. It makes a difference. It makes a difference. But yeah, that's emotional awareness when we are working in the chair, in the patient's mouth. And it was a coincidence that you had
Yes.
that case today, but okay,
But it was,
it
yes,
served it
it's
served
good
for
it's,
us
that
to
it
to
served for the
illustrate.
exercise. Yeah.
Yeah, yeah. What about emotional awareness when we are talking to the patient?
An
When
emotional
we
awareness of myself or of the patient.
both, both.
Mm-hmm. I
How do
am,
you not lose
I
control
am,
of a conversation
I am
in a patient?
usually,
Because in dentistry
yeah,
is difficult, huh?
yeah. I'm a very experienced dentist, right? So you have to
Mm-hmm,
take account
mm-hmm.
of that. I'm a very
So
experienced in
what
terms
what
of,
what advice would you give to a dentist that has no experience, that is just starting, a young
so what,
dentist?
okay, so when I say I'm very experienced, this gives me a lot of confidence, right? And you can feel that when you are around me as a patient. You can feel that. I don't even have to talk about that. Maybe it's the energy, maybe it's the poise, maybe it's the tone of voice, but I'm extremely confident around patients. Extremely. But that comes from where? That comes from the most important thing is that because I teach so much, my mind is very structured in terms of technical part on what are the treatment options. So I can be very articulate talking to a patient about treatment plans and in a very short period. I mean, in half an hour, I can make it very clear for a patient what the complex treatment plan can be done in terms of this is phase one, phase two, and phase three. But the reason why I do that is because I am very confident on the technical part because I teach every week, so it's very structured in my head. So that's number one. Um, so that if you are very confident talking to a patient, you are much more in control of your emotions because the fear of not knowing what to do is no longer there, occupying your mind and making you stressed, right? So confidence comes from a lot of work, right? So yes, that emotional stability comes from the feeling of confidence that comes from a lot of work and a lot of studying for many, many, many years, right? So it's not like that you, okay, I'm confident now. But okay, you asked me, what would be some tricks? Some tricks would be, don't open your mouth too early. Do initial examination. Listen to the patient much more than you talk. Listen to the patient, and don't feel obliged to say something definitive on the first appointment. Go study your stuff, take your time, so that on the second appointment you deliver the treatment plan, right? So don't compromise by talking too much, because in the beginning you like to impress people and you just talk too much and you open your mouth too early. Say, look, we are going to study this, and then I'm going to present a treatment plan. So that would be my advice. And I always talk about this. So the importance of the initial examination, like we did in one of the last podcasts. But you also asked me, okay, so emotional awareness of yourself and of the patient. So for myself, it's easy now, because because like I said, I'm very confident because I've worked very hard for the last 20 years. Do I still have patients that trigger me? Yes, I do. I do have patients that trigger me. Let me give you, this is not in my practice, but how I dealt with the situation. She was a patient, she was referred, she had some wear. She was not Portuguese. And she came and she said, okay, we will do this. And she agreed to do the mouth guard. But then, first of all, she started to complain when we were 10 minutes late. And for me, you get into trouble if you get in the appointment complaining, because I will place you as soon as possible. I will place you on the right spot. I will not allow you to do that, because I tell them, look, I always tell them, look, I am late. I'm sorry because we had a difficult morning. Just 10 minutes. Oh yes, but I am an owner of a business, and I have to get a paper declaring that I was here for this hour until next hour. I am the owner, but I have to give the example. And because we are late, and she arrived like this into appointment, I was like, look, I immediately told her, look, I know I will find a way to place her on the right spot. It's not going to be, I'm not going to react now, but I will tell her sooner or later. But I didn't tell her anything in that appointment. So we did the impressions and everything, and then it was the other appointment. And the other appointment, I was about 15 minutes late, and she arrived. Oh, you are late again. You should have told me. And I was like, okay. I told her, look, I think you are absolutely right, but do you know what we are doing here? I said, why are you asking that? But do you know what I am doing here? No. Do you know what I am treating? Am I treating, is this like selling a product? I was very serious. Is this like selling a product? No, it's not. You are treating people. So when we treat people, this is not math, this is medicine. And because this is medicine, imagine that if you were here, something was not right, and I could have had the choice. I could stop the treatment and go home with an unfinished treatment just because I want to be on time for the next appointment, or I could finish your work as it should, because this is not, I'm not here treating dummies, I'm treating people. Are we clear with that? And I completely make a drama there. Are we clear about that? Because if we are not clear, you can go and see somewhere else. Because I'm not. I don't tell her this, but I tell her, if we are not clear regarding this, I'm going to do my best. But you can find someone else, and I will just give your money back. And I tell this in a very sweet and very calm way. So it's very surprising for them. They are not expecting this sort of reaction. Because sometimes some sort of people, they try to push you to see where you can go. And it comes to a point that for me, when I enter this mode, I want them to leave. I don't want them to see anymore. So I am always on the verge of telling them to go elsewhere. Always. And it's not in an aggressive way. it's in a peaceful way. I want to find peace. I want this person out of my life as soon as possible. Because once they pass a certain threshold, I want to let them go. And we continue on, and I placed her the mouth guard, and she didn't like my approach. And she says, well, but this is a very big mouth guard. Well, yes, that's the way it is. And actually, also in the first appointment, I told you should see a physiotherapist because of your neck pain. Oh, but she was. You could see on her body language she was not valuing me that much. And I told, look, you go if you want to. If you don't want to, it's the same for me. It's exactly the same. I tell them this. So of course that she doesn't like this approach because these sort of people, they are used to, when they push some people, they are used to people that enter that game and try to please them more and more, which is the hairdresser style, which I never enter there. I never try to please them. I try to please them up to a point, but once I see they just go over some boundaries, I respond to them. And on the second appointment, again, she was telling me, but this is just a large. Oh, but my daughter has I told, look, these mouth guards, they are always like this. No, my daughter has a mouth guard. It's much thinner. Well, but what is your daughter's mouth guard? What's the reason? I said, well, because she doesn't want the teeth to move. She doesn't want the teeth to move because after ortho. I said, well, but that's a completely different story here. This is the reason. And when I saw her that she was pushing boundaries, I said, look, I'm going to give you the mouth guard. If you want to use it, it's okay. If you don't want to use it, it's exactly the same for me. Don't use it. I will give your money back, and you can go and see somewhere else. And I tell them this, looking them straight into the eyes, as sweet as I can. But to make them understand, I don't give a crap if you like my style or if you don't like my style. But I have done my best. I am a doctor. I'm not an hairdresser. And you are pushing yourself too far. And I don't want you in my professional life. This is my approach. And I know this can be a little bit. This sounds a little bit too dramatic. I am as sweet as possible talking to them in terms of the way that I talk, but the contact is absolutely aggressive. It's really like, there's no doubt that I want you out of my office as soon as possible. It takes a lot. It's very rare that this happens, like once a year or something, maybe once a year that happens. It's very rare. I'm usually very sweet with my patients, but I don't want these people to take control of the situation, because this is a person that, if you are not careful, she completely grabs you by the balls and you are completely fucked. And these sorts of patients, they will happen to you. Then they will appear to you. So I think that you have to develop a strategy that you feel good about yourself in the way that you treat them. But if the patient is always trying to doubt your advice, so why are they there? So they agree to do a mouth guard and they see it's not worth it. So if they think that your advice of going to a physiotherapist is not worth it, so what are they doing there? They basically are just using their energy to lower and lower and lower you, and you have to get rid of them as soon as possible in an ethical way. And I told, look, you just go elsewhere. You just bring me the mouth guard. I will give you the money back, and you go and see somewhere else. But it's fine. If you want to use it, it's fine. If you don't want to use it, it's exactly the same for me. It's your choices, and you are in charge of the situation. You know why I explain you why you should be using it. And by the way, whenever I treat TMD's patients, I always use like a sheet with everything written down, with the conversations that I usually have with them, that they need to see a physiotherapist, they need to do some physical exercise, etc., etc. And when that person, and I treat dozens of patients like that every year without any issues, because you have to be compassionate with these patients. Sometimes there's some emotional things going on. And when you see these sorts of patients that don't have pain, they just want to use it to avoid wear. And in any other sort of treatment, sometimes they want to take control of the situation. And you cannot allow that to happen, because these patients, they will completely ruin your days. You have to get rid of them, or you have to get rid of their behavior as soon as possible. And I think that yes, you have to be very tolerant with patients. But once they surpass a certain, it doesn't mean that you cannot forgive them. It doesn't mean that you cannot go back to a normal relationship. But if they sustainably, in a systematic way, try to push you, you have to get rid of them. And I'm very trained of that. I remain very calm there, intentionally calm. But they have to understand that their presence in my life is completely, it's indifferent. It's completely, I prefer not to see them actually. And they have to feel that in a very, very unexpected way sometimes. And because I really want them to get out of the practice as soon as possible. Because that's just it's not possible to do that. And I think that every patient, every dentist has these sorts of patients. Every dentist.
Yeah, and that fills in the category.
But sorry, just to finish. Now, what's the emotion behind here? I am very trained with. I smell these patients. I'm very trained with these patients, and
what's the trigger?
I used to have some tachycardia when this happens because I know. Look, I don't want to lose control.
You immediately feel
I don't want to lose. I used to feel that a couple of years ago, but I don't anymore. I do intentionally exercise to start speaking slower. Start to speak in a very sweet voice to them, but to be completely lethal with the words. And but it's something that you have to train. So you have to tell things not in a disrespectful.
Are you assertive or are you aggressive?
I'm assertive, very assertive.
Assertive.
Yes.
Okay.
Not in a disrespectful way in any way, but you have to tell them, look, if you are constantly doubting what I'm telling you, I think that if you want to use the mouth guard, you use it. If you don't want to use it, you don't use it. But it's the same for me. It's exactly the same for me. And I'm willing to give back the money that you paid for that because I want the best for you. But if you are constantly doubting what I'm saying, there's nothing more that I can do. And I'm not going to get mad if you don't use it, but you just have to see someone else. Because I think that it's always better to stay red for 10 minutes than yellow for 10 years. I always think that. Because these sorts of patients, if you keep babysitting them, they will completely take over you.
Yeah, they're difficult patients, and they will make your.
So I think yes. Initially, I would get anxious. I would even shake sometimes when I felt like this guy's crossing the line, and I have to tell something because I know that I need to tell something, and I will start with tachycardia, with anxiety, with nervousness, and I think that with time you get to understand that.
But that's very interesting what you're saying. What you're saying is that you identified the patients that triggered you.
Yes.
So you start to identify the difficult patients that triggers you.
Yes.
You completely identify the way that you feel even physically.
Yes.
That you were stressed about them, so that they triggered you, and you were able to find a way to deal with that.
Yeah.
So even what you are describing is, I talk slowly. Probably, if you talk slowly, you also deep your breathing also in order to calm yourself, so you not to have that tachycardia anymore, and you are able to be assertive. And like you say, you talk in a calm way, but you are assertive so that they understand, and you are also prepared for them to walk away.
Yes.
Yeah,
I think that's the
that's
trick.
it.
Yes.
Yeah, that's it.
You have to be prepared to walk away and to lose the patient. So I think it is like, oh, I'm not enough for this guy, and it is okay. Do you understand?
And you will never be enough.
Maybe I could have. Because
no one.
Because one thing is testing you, and we talk about this. We talked about the masculine and feminine. One thing is testing you, which is the thing that women do a lot with men, the thing that patients do a lot. They test you once, twice, 3 times, which is legitimate because if they are. But one thing is testing. The other thing is annoying you and doubting and completely trying to place you down on a systematic way, right? And if it's like, okay, why? It's like they talk to you in disdain. Though, why is this going to work for me? Why are you? So they say that they want to do a mouth guard, and then they are saying, well, why is this going to work for me? I mean,
they are doubting.
Doubting. Yeah. So what are you doing here? I mean, you have to go away. And I think it's so. how do you draw the line of testing versus abusive?
That's exactly
Yeah,
what I wanted to ask
yeah,
you, because that's what I was going to say. You learn to identify your triggers, but your triggers are difficult patients.
difficult patients. Yeah,
So your triggers are the ones that are difficult, and the ones that you identify
yeah.
that you don't mind losing. Okay, this patient
Actually,
is
no, no, no.
difficult.
You are wrong. I don't mind losing anyone, any of the patients.
Okay,
I don't.
okay, I understand. Yeah,
I
but
don't.
but the
This is
difficult
the, yeah.
ones you learn to identify, and you learn to deal with that, and you identify that they trigger you and that they can make your life very hard.
Yeah.
And
And so
so
don't forget that I don't think I was right when I tell that I'm not afraid of losing any patient. I am afraid of losing patient when there was a technical issue, when I failed
mhm,
technically. I think that I would
mhm,
not like to use. So if I
mhm,
did, and
mhm,
I've lost in the past. I've lost. I
mhm,
remember
mhm.
one girl that I did a crown that I lost the contact point and she never came back. That was a technical
Does
mistake.
that?
So I don't like
Mhm,
that because that was my fault. I could have done better. But if it is just a question of money, if it's a question of disagreeing with the technical part, if the patient disagrees with the plan, if the patient does not, uh, if he's fighting the plan all the time, it's just all in disdain. Oh, I don't
mhm,
like this. I don't like. Why am I doing this? This is not. So I don't like to do anything unless the patient is motivated to do that, and because the patient
mhm.
is an important part of the healing, as you know, right?
Yeah,
And
the patient is an important part of all the process,
yes,
because
and if they are not
the
with you,
yeah,
if they are not with you,
yeah,
your
that's
life
it.
will be miserable. Yes.
Yeah.
So I think that it's very important that you have to. Yes, most of the patients, if it is not from a technical point, not a technical mistake, I think you should be ready to let them go. And this is why it is so important, the initial examination, to explain the
Mm-hmm.
treatment plan, to see exactly what type of patient you have in front of you.
Mm-hmm. Mm-hmm.
Okay, this
Yeah,
is
yeah,
why
yeah,
it
of
is
course.
really,
Yeah,
really important to know we have to do this, and that. Okay, but you
yeah.
were talking about something else, which is
I was talking about how, because we know there's difficult patients,
yes,
and those are the one that triggers you now.
yes,
But there's also the typical dentistry patient that doesn't like the dentist,
yeah.
you
No,
know?
that's okay. Yeah, but that's okay.
But how you, because now you have the experience,
Yeah,
and you have the awareness,
this. It's very
but how
interesting.
you as a
Yeah,
dentist,
yeah, yeah. I
take control
think
of the situation.
I think that this is very interesting because I had the first place where I worked. It was in Aveiro, and Doutora Lúcia Ferraz e Américo Ferraz. I worked there for the first 3 years, and one thing that she told me, and I completely agree with her, is that when you are a dentist, you develop a lot of, you see a lot of people, and you see a lot of people in a place where they are not very safe, they are insecure,
No.
and
Yeah.
and it's very, you develop the skill of knowing people, knowing their emotional reality, knowing what they're made of, much faster than many other health professions. Why? Because you see a lot of patients, right? And you work within sometimes painful procedures with them. You work with them, pushing them to the edge. You know how they react to pain. You know how they can handle. You know how they can overcome their fears. So it's you know the emotional strengths of people while you are there, especially if you are doing a complex treatment plan. And it's very easy to spot people that there's something not right with them. There's something that is not right. This is not common. So if you see a lot of people, hundreds of people, and one of them, there's something that is not right, that the way that it talks to you is in a passive aggressive way, is always doubting you. Um, um, you see that he does not want to be willing to help you on the treatment plan. These sorts of people, you have to be aware of them because they can sabotage the treatment. So if you tell me, how can I differentiate testing I mean, everybody tests you, so it's very common
Yeah,
to
that's it. Because in
yeah.
the dentist,
Everybody
you
tests you,
have
yeah.
to.
So I hate dentists. I don't. Oh, please, I don't like. And the first thing that I do is I play with them. Oh, me neither.
Mm-hmm.
I hate dentists.
Mm-hmm.
I don't like dentists at all. But let's see what we can do. You'll see. You'll be
Mm-hmm.
fine. We don't have. So let's just take our time. If anything is urgent, just let me know. There's no rush to do anything. We can do the things as you prefer. So as long as you understand the treatment plan. One thing is treating tooth by tooth. The other thing is like doing complex work, which is completely two different types of dentistry. But treating tooth by tooth, it's just like, okay, we'll take our time and it's okay. But if it's complex dentistry that can take like 1 year, 2 years, you have to tell the patient, look, this is a commitment from yourself. You are going to spend money, but you also need to have some commitment. Why? Because you have a problem. You have a problem that needs to be fixed. So you are always associating their problem with an health situation, not with a cosmetic approach. It's not something optional. They have to do this either way, or in one way or the other. They have to do this, right? So you need commitment from that person. So I think yes, everybody tests you, but if you think they are sabotaging, I think that the best way to describe it is if they sabotage the treatment, if they intentionally or unconsciously, if they are sabotaging the treatment, if they are always doubting what you say, if they say, "Why am I doing this? I don't think I need this." Those are the patients. I think
That's. Mm-hmm.
if there was one thing that I would say is that the patients who sabotage the treatment and that
Mm-hmm.
say yes and they are always in doubts and they are always telling you that you don't, that in a subtle way that you are not. So these sorts of patients, you have to get rid of them as soon as possible, in my opinion.
Uh,
In my opinion.
another thing that I wanted to ask you, I don't know if you are in a position of, I think you are, because you teach a lot and you speak with a lot of colleagues. I have feedback from women colleagues, dentists, saying that there are certain
Mhm.
situations that they are sure
Mhm.
if it was with the male
Mhm.
dentist
It was different.
that
Yes,
it
I
was
agree with
different.
it. I agree.
Yeah,
I think there's a lot of
yeah.
sexism everywhere.
Mm-hmm.
And yes, I actually in the practice that in the classes that we teach, I usually give two different examples. One is the male dentist treating a female patient, and the other one is a
Mm-hmm.
female dentist treating a male patient. And yes, I think there's that thing about sex. There's also that thing about with age also.
Mm-hmm.
But with
Mm-hmm.
sex, that certainly is. And I wish I had an answer for that. Um,
There's
but I would say learn to use your masculine to women, learn to use your masculine energy in the office. Forget about it when you get home to your boyfriend, of course, but learn to use that in the office. And masculine energy is not aggressive. It's assertiveness.
it's
It's
assertiveness.
assertiveness.
Mm-hmm.
That's
Mm-hmm.
it's
Mm-hmm.
decision making. It's
Mm-hmm.
that's masculine energy. Either you are a man or
Mm-hmm.
or or or,
Mm-hmm.
or a
Yeah.
woman. Yeah,
Mm-hmm. Mm-hmm.
yeah. But
Mm-hmm.
I also
Yeah.
think that I when you are very experienced dealing with patients, sometimes it's difficult to decodify what's going on inside your mind to tell younger dentists. But I think that doing an initial examination to tell the patient exactly what's going on and not being afraid and accepting that not everybody is going to like you. I think that's a huge advantage, and it will save you a lot of time.
Mm-hmm.
And just do the procedures that you feel that you can do or that you are willing to
Mm-hmm.
do. Don't try
Comfortable.
to look anything that you are not. I
Mm-hmm.
have a lot of there's a lot of things in dentistry that I'm not good at that I don't do, and I'm very open about them with patients.
Mm-hmm.
And I call
Mm-hmm.
for help whenever I want, whenever I can. Some very complex surgical stuff I don't do it. I'm good with periosurgery, but I'm not good with, for example, with bone augmentation and stuff like that. And I'm very open about it. And I don't think you should never try to go to look to,
To go further for
yeah,
than your
than your
technical
skills.
skills,
Yeah.
right? That will bring
So
that
so yeah,
anxiety.
I think
Yeah,
that having an
that's working
initial
on anxiety.
examination to know get into the patient, and don't be afraid of telling that you don't know something, and also not being afraid of losing the patient. I think this is important because in your 20s you think that you can please everybody. You can't. It's impossible to please some patients, and some patients they are really passive aggressive, and they will try to go way more than test you, and when they start to sabotage the treatment, it's just better to have an open. Sometimes, for example, I was even thinking about what I was going to tell in the last appointment with her. I was thinking, what am I going to tell this person when she comes back? And my conversation will be very open, something like this. If she says, look, this doesn't work, that would be perfect. Because I said, okay, that's perfect. Just bring me the mouth guard. I will give you the money back and you just find someone else. And I'm sorry I couldn't have help you. And it's over. But if she comes and she still wants to keep with me, and she still doubts, and I will, if I feel that she's still crossing the line, I will tell her, look, I think there's something between us that is not functioning very well. Am I right or am I wrong? Maybe I am wrong. Maybe it's just a feeling that I have, but I just feel that you are constantly doubting what I say and sabotaging the treatment plan. And this is not comfortable for me. I don't feel comfortable with that. And maybe it's just a feeling that I have. But if this is the case, I want to be as respectful to you as possible. And I would like you, if possible, to find someone else to help you, because I don't think that maybe you don't like my face, maybe you don't like the way that I talk to you, and I'm sorry for that. But I think that I cannot help you anymore. Just I'm going to make sure that I'm going to give you all the money regarding the mouth guard, and I will be happy to refer you to someone else. But I'm sorry, there's something here that I don't understand. And I've been working dentistry for 20 years. This has rarely happened to me, but this is not, maybe you just don't like me. Maybe you just don't like the way that I talk to you. Maybe just, I'm sorry, but we have to split. And this is the conversation that I tell with them. And it always be, I think it's important that you are always be willing to assume a loss, to assume your fault, because it's never only the patient's fault. Maybe just I cannot do better. Maybe I just don't empathize with you. Maybe it's just my fault. I wish I could have done better, but I can't. And I feel that you are always, that you are very, you are conditioning a treatment plan. You don't like what I say. You don't follow what I say. You are always contesting what I say. So I don't think it makes sense for us to continue. And I'm sorry for that. I think this is the best way to be completely honest about that.
Yeah, I think so. It's interesting because you were talking. I was remembering of a conversation that I had with a colleague from the UK a few weeks ago, and he was telling me that one of the problems that he has with dentistry nowadays. So he's about our age. He's also more than 20 years. He has more than 20 years of profession. And he says that one of the problems that he has with the profession nowadays is that he feels like he's playing a part. You know, he feels like he's an actor.
Yes, he gets cynical.
So
he gets cynical.
Yeah,
Yes.
that's it.
I know that. I know exactly the feeling.
Tired, and he's tired. He's tired. So one of the benefits of having also the emotional awareness is to be able to bring this assertiveness to your actions. So if you are aware of what you are feeling, you can act based on that, and that is assertiveness. So that means that your speech is also coherent with your actions, so it's aligned, and it allows you also to be authentic.
That colleague in the UK that you were talking about, what's the struggle? Does he feel that he needs always to find a positive solution for the patient? Is that the situation?
Yeah, and again, dentistry has a lot of layers.
Yes.
So of course he's also in a position where he is unhappy because there's a situation going on in the UK with National Health
And with
Service
NHS,
in
yes,
dentistry.
everybody's
Yeah.
dropping from NHS,
Yeah. That's it. And he has a private practice, but he still works a few days in the NHS. So he's actually struggling if he wants to continue or not. But even dentistry, and he just feels that the dentistry that he's performing under the conditions that he has.
Yes.
He doesn't feel that he can change.
Yes.
He
In
doesn't see any
NHS,
change.
yes. That's why most dentists are. I have interaction with a lot of UK dentists, and what most of them are saying is it's impossible to work with NHS. And the feedback that I have is that most that left NHS are happy, and the way that NHS has been done is it's just not practical any longer. And I think the feedback that I have is that NHS needs a huge revolution to be able to be sustainable for dentists, because it's
because if you consider to work in this way that we are talking, I mean, based in self-awareness and compassion and bringing
you need to have time.
Yeah, that's it. You need to have time.
You cannot
you need
do
to have time. You need to have courage also.
But you need to have time. You need to have time.
You need to have time. Just one last thing before we finish, because it's already a long one.
We beat the record with this one.
But or maybe we divide it in two.
Okay.
We'll see. But I just wanted to acknowledge something that also you were talking, and I think it came to mind, and I think it's very interesting. I'm from a generation, and you are from the same generation as I, that it was talked a lot about self-control. We have to have self-control.
Yeah.
And nowadays, things are changing based on the knowledge of emotional awareness, of emotional intelligence. So self-control is that you are able to stop a certain behavior, in a certain situation, right? You are able to stop a certain behavior.
Okay.
But this self-control also came with the idea, okay, you are able to control yourself in that situation, but you are not able to change. So nowadays,
what do you mean? What do you mean? You're not able to change?
Let me explain. Nowadays, you have this idea of self-management instead of self-control, or self-management or self-regulation.
Okay.
That means that you are able to bring the pause that we were talking at the beginning.
Yeah.
Right? So to stop the reaction.
Yeah.
And you are able to change the behavior after the pause. So this means that you don't have to have self-control, but you can manage yourself. You are able to regulate yourself, and you are able to change your behavior if you feel that's more appropriate in order to solve a certain situation.
But not change yourself. Is that what you mean?
In self-control, no, you are not able. There was this idea that you were not able to change yourself. So that's what you are, and you will continue. But you can control yourself in certain situations.
No, I think I think it's number two for sure. I think this, because I think you have to change yourself. You have to be able to change yourself.
But that is only possible if you bring awareness.
Yes. I don't think you can block yourself, because if you block yourself, I think that you have to really change. This is why it's so important to have this notion of defeatedness, because it's in a certain way it's a defeat. I mean, I was not good enough for this patient, and I think it's the acceptance of what
I think
is
it's more
happening.
acceptance. Yes. I think it's more acceptance.
You accept this situation. You are aware of this.
Yeah.
So this is what it is. I I couldn't.
Because
This guy,
acceptance is not resignation.
Yeah.
Acceptance is seeing things as
As
they are,
So
not as we wish them to be.
I was not
but
able.
Just accept.
I was not able for whatever reason to please this patient. Right? So I accept this. I accept this. But this either you like it or not. For dentists, this always has the taste of defeat. Because we are made to please patients, right?
Yeah, so, but that's what we were talking about. Dentistry is a big part of who we are.
Yes.
And so it's a part of us.
So you have to be able to say, look, this is what happened. I was not able for whatever reason to please this patient. This is what happened. This is acceptance. Okay. So I accept this, and therefore I'm going to act according to this. And to act according to this is to find the best solution for both. And sometimes it's to split away in a respectful way, in a respectful, honest way, and to be able to speak, to be able to talk about things clearly and without violence or without aggression, which is also extremely important. But you have to draw a line there. You have to draw a line and to say, look, I don't think we should continue with this relationship
and there's
anymore.
There's also a very freeing things in referring patients, in feeling that, okay, this patient is not for me, I cannot help him the best way, I will refer him to a colleague that might help him better. And that is something that I think in Portugal you don't do that.
Don't do that. Yes.
Here in Belgium you do it. And it's like in Portugal, I think that when you refer,
you have the feeling of a loss.
You take it as a defeat, like just like you said. Especially if one thing is to refer to do a technical procedure that you don't do. Like, for example, you don't do children, and you refer it to a pediatrician to go treat it. That you have no problems on doing it. But if you refer to do something that you yourself do, then it's like you don't do that. It's not normalized. Here it's a normal thing for you to do that.
UK is also normal.
It really sets you free.
Yeah, but the thing is that
good thing.
I think it has a lot to do with the Latin way, because patients are connecting to the dentist, the human being, much more here in Portugal than in the UK. Because in the UK, in some northern, like in Luxembourg or whatever, you go there for a technical treatment. If there's someone else that is better than this one, so I'll go with. It's not about the person; it's about the technical treatment. So if he talks too much, or if he doesn't talk too much, if he asks me about my kids, or if he doesn't ask me, it's the same for. But not in Portugal, it's different. In Portugal, people they still have a lot of the connection. Oh, I am a friend of the dentist, and this is why I think we take it so it's so personal when we have to pass a patient, because we have this. I think that in Portugal you always develop some sort of relationship, professional one, with some sort of close connection with the patient, which is something that does not happen in some other countries.
But that's why you should have more emotional awareness, because it's an emotional relationship, and that's why patients become triggers, and that's why I see a lot of colleagues that their clinical practice is transformed into their biggest triggers is their patients. The ones that they are supposed to serve are the ones that they cannot stand.
Absolutely. No, so, but you have to be able to. I think that the word is exactly what you said. It is. You have to manage yourself. You have to accept that there's a situation that it's out of your control for whatever reason. And you have to accept that, and you have to manage your behavior to be able to deal with the situation in the most smooth way, respectful way, non-violent, not aggressive, but still assertive, not aggressive in any way, but still assertive. And you can also use some words like, I want to be as respectful to you as possible. I want the best for you, but I don't think that I will be able to help you. And I'm more than happy to find someone that will take the best care of you. If you use all these words, but you are still assertive that I cannot do better than this, I think you will be okay. But you have to develop that courage, of course.
Yeah. Another very important thing about the last one,
Okay, it's
I
fine.
promise. The
It's
last
fine
one.
for me.
Another
Still half an hour
very
before I go to
important,
sleep.
another very important thing about emotional awareness is that it connects you with your intuition, with your gut feelings, and they are.
Yeah.
I think they are also a superpower in
Yeah.
dentistry. But if you are completely disconnected from your body, if you are completely just running in autopilot during the day, you completely ignore that, or you might even sometimes be aware of I should not do this, but because you are not used to listen and to act accordingly your gut feelings, you completely ignore, and then usually it ends up in frustration, and knew I should not have done this, and why did you do it? Because you forget that we have a body wisdom, and we just trust our mind.
I completely agree with that. And I was telling that I think that we as dentists, we develop with experience. If you talk to an experienced dentist, he will tell you that. He will tell that sometimes you smell people.
Yeah, that's it. Intuition is a superpower in dentistry. Intuition, the more experienced dentists always are very intuitive.
I agree, and I am very. I sometimes I have some very bad vibes from patients, but it's just the first appointment. You have to maybe just let's just see things as they are and not just as you are feeling. So yes, there's something wrong about this guy or this woman. Okay, let me just be professional. Let's see what's going on. Let me interact to see what's going on. And sometimes you have some surprises, right? But most of the times, I think that if you are an experienced dentist, you will see that your intuition, if they say there's something wrong, that will be down the road. You will find it. You will find it.
And even clinically, those small that are not so small, but decisions. For example, when you have a tooth that the patient does not want to extract, you want, but can you not save it? Can you not save it? And clinically, and with all the exams, X-ray, whatever, you see that it's not possible. And he's like, but can you? And sometimes because of the pressure, and if you act based on empathy, you do like, okay, let's, and it's going to fail. Then why do you do it? Don't do it.
I think it's more or less the same thing. You have to. Yes, you have to be able to
assertive.
You have to be assertive, but you have to also set the boundaries for yourself. This is what I accept, and this is you cannot treat a patient that is fighting the treatment. And I think that's a good conclusion that we reach. If you feel that the patient is fighting the treatment, she's always in disdain. She doesn't want, or he doesn't want to brush their teeth. Is always, this makes no sense for me. Why am I doing this? Why am I spending money on this? It just really makes you feel bad. And you really have to draw a line there. Look, you have to be a part of the treatment. If you are, it's fine. If you are not, maybe it might be my fault. Maybe I'm not handling it well, and I accept that. But you probably have to find someone else. And I'm here to support you in that decision. And if you need anything from me, I'm here to help. But I don't think that I'm not feeling very. I don't think this is very healthy for you or for me, because I'm doing my best, and you are. And what I feel is that you are not helping me. And I think that I am just. I don't want to be in this fight alone. I'm doing my best, and I want you to help me here. Even if you are paying, yes, you are paying, but this is health, right? This is not your hair. And I think this is something this is like this trick that you always need to tell patients, look, this is health. This is not haircut. This is not manicure. This is not, this is health, right? This is not cosmetics. This is health, right? And if it is health, sometimes some things may not go as expected.
Okay, it's a nice
that was
conversation.
A long one. That was a long one.
Nice conversation. Just to finish, let me say to the ones that are listening, in order to start building some emotional awareness, just start paying attention, start to pay attention, start to be aware of yourself when you sit on the chair to work. How does your body feel? Check your body tension, see if there's any muscular tension, sense if you are happy, sense if you are able to be yourself, if you are able to be authentic, if you are enjoying it, how that expresses also in your body. So emotional awareness always starts with first body awareness. So start really paying attention to your body awareness and start naming your emotions, and always remember what you said, Andrea. It's very important. Patients are always testing you. It's part of being a dentist. So don't let that transform into triggers, because difficult patients are in fact big triggers.
Yeah, and they will happen. They will appear,
and
to
they
you.
will and they will happen. But everyday dentistry is made of normal people, and normal people don't enjoy going to the dentist.
Yes.
So they are always going to test you, and it's not only anxiety, it's money. Money also, when it's that patients feel like the dentist is too expensive, they don't value it. We all know that. So they are always testing you. It's not even in a conscious way, it's very unconscious. So don't let that take away the joy of your everyday dentistry. Don't let that control your days, and don't let your days be run by the autopilot mode. Just bring some awareness. Otherwise, you reach the end of the day just feeling completely disconnected and completely with no meaning in what you are doing. Okay, so
and placing
so
things
much
in perspective.
Yeah, if you can reach the end of the day and really, if you sense that something or if something that went not so good is you are thinking about it, just analyze, just bring some perspective, just learn from it, just take action in order for the next time it doesn't happen again, or if it happens, you have the right tools to deal with the situation better. Just like you said that you are going to bring some action with the assistance situation. So again, thank you so much for the conversation, and for the ones listening.
Session.
We went into the emotions field today. No, so thank you so much. Just to remember everyone that we are going to have our course in October. Just go to softbites.online and you will have all the information where we cover all of this. We cover mindfulness, self-awareness, self-management, systems and protocols, and everything in order for you to be able to enjoy your days as a dentist. Thank you so much for listening, and we'll see you in the next episode. Thank you, Andre. Bye-bye.
Bye-bye, everyone. See you next time.
Bye.